So I'm going to tell you about two blocks out here. Can you get it closer, the machine? So I'm going to talk about the quadrant. First I will tell you about the lumbar plexus, then I will tell you about the quadrant lumbar block. Okay. For the lumbar plexus, lumbar plexus will be formed from L1 to L4. Okay, and anterior primary rami of L1 to L4, and then major branches are the femoral nerve, little cutaneous femoral nerve, obturator nerve, and sometimes you have accessory obturator nerve also coming from the lumbar plexus. And it has a three ways of giving a lumbar plexus block. One is the Shamrock method, where you put the patient in the lateral position, and where you want to give right or left, depending on that, you give the position to the patient. You place the probe in the along the iliac crest and between the posterior margin and the iliac crest. Okay, you just place it out here. Okay, as you place the probe, you get an image. Okay, so our landmark out here will be like checking for you want to see three muscles. You can see the three muscles. Can you define them? These are the you have the three abdominal muscles. I'll show you again. Okay.
External, internal,
Transfer abdomen, and just trace them laterally, and you see a big muscle out there, and that is our psoas muscle. Okay, and
this one.
Okay, on the top of this is the transverse process. Okay, and on the top of the transverse process is the quadratus lumborum muscle, and below that is the psoas muscle. Okay, since quite far off from me, so I would have shown you here. Okay, this is the psoas muscle. Okay.
Which one is transverse process?
The bony appearance, the bunny head, that. This is the transverse process, and the flat one will be the vertebral body. Okay, and this is the psoas muscle on this side, on the left side.
Transverse process and
This psoas. Okay, on the top is the quadratus lumborum. No, not that. Okay, just freeze it. Okay, let me come out here and show you. So you have basically your three muscles in the posterior compartment of abdomen. One is the psoas, this is the quadratus lumborum, and this is the erector spinae. This is the transverse process, lumbar transverse process, and this is the vertebral body. Okay, I just want to once out here you want to give this lumbar plexus block. Usually they lie in the posterior 1/3 of the psoas muscle. Okay, usually use a nerve stimulator also. Once you come out here, there will be a contraction of the quadriceps muscle. Once the contraction of the quadriceps muscle, then you know that you are on a lumbar root. Mostly it is L3 or L4, and then you inject the drug around 20-30 ml of drug in that. But it's a it's also vascular area, so you have to be careful while you inject the drug. Okay. This is the Shamrock's method. You can see it's the three leaves. It's like you have one leaf out here, it's other leaf, it's other leaf. Okay, you have the three leaves, and these are the abdominal muscles. Okay, I will show you. So how do you give this block after you see the? So you see the structures. So here you see the structures. You see the you see the three muscles. Then you slightly show the probe. Okay, then what you tend to do is just slightly tilt the probe, quarterly. Okay, and now show the monitor. So what the difference basically, you see that the transverse process is gone. Okay, and now we can see the psoas muscle only. So you will not hit the bone when you come, in plane. And I show the patient again. And usually the beam is would go like this. So you have to see the distance, where the lumbar roots will be there, and according to that distance from the probe, you will put your needle in the skin. Usually, or it is usually from the midline, it should be 3 to 4 centimeters from the midline. Can you freeze that one? Can you show the monitor? So you come from this side, okay, and you come here. Otherwise, you initially would have come, you would have hit the transverse process out here. So now, if you come, you will not hit the transverse process, and out here you will. This is basically the lumbar root. Okay, you will inject drug out there. So this is one way of giving lumbar plexus block. Okay, stop.